What do y'all do? I believe we should have universal health care. I believe every American should have health care as a right. We spend enough money on it. I think it's a basic human right. And I think it's actually smart economic policy. I don't want people tied to their jobs. So the way I would get there, however, is not with a one-size-fits-all, the government gives you everything. Because I don't think that works. And we have ample evidence to suggest it doesn't work, because Medicaid and Medicare have never actually paid the cost of health care. And we needed private insurance to actually, in many ways, cover the cost of health care. So what I favor is leaving Medicare alone, giving everyone a new federal health care program as a right from when they're born to when they turn 65. And it would have basic kind of health package similar to the Affordable Care Act. Medicaid would roll into that. But the American people would have options, right? A, they wouldn't have to take that if they didn't want to. They can opt out, get a tax credit, and buy private insurance. I don't think most people will do that. I think what a lot of people will do is get supplementals, similar to what they do with Medicare. So you have a base government plan, and then they can get different bells and whistles by getting supplementals. So I would envision the way the market unfolds for my new program, which is from birth to 65, is that everyone would have their basic government plan and then they'd get additional options. And I'd pay for that whole system by taking away the corporate deductibility of healthcare, which is a massive, massive tax break. And that basically pays for this whole system, which doesn't mean companies wouldn't be in the healthcare business. I think what they would do is negotiate these group supplementals for their employees. So that's the way I create a fully paid for universal healthcare system, and it's a mixed model between the government and the private sector.